my computer says it's 5 o'clock, so does my watch. So I'm going to get us started. I will officially call to order the special meeting workshop of the Board of Trustees of the Coeur d'Alene School District 271 for August 16th, 2021. Do I have an approval of the agenda, or a motion to approve the agenda?
Second.
All in favor?
Aye.
Aye. All right. And with that, I will turn it over to Dr. Hawker.
Thanks, Chair Bromley and members of the board. There is no agenda actions tonight. This is a workshop. It's a workshop only. And as such, the board and the directors, I'll try to talk super loud. And so as such,
Viewing audience at home.
Test, okay. And so as such, the board will be working, asking some questions. We're going to present these 4 topics for the board to kind of work through. It's super imperative that the board's able to conduct this work. We can't have any noises or distractions from the crowd. This meeting is being live streamed, so if you would rather head home and watch it from the comfort of your couch, you're certainly welcome to do that. We need to make sure that this walkway through here is clear. Obviously, we just don't have large facilities, but for fire escape purposes, we've just got to maintain a clear walkway here. So again, I would just ask, you're more than welcome to come and watch the board work and just kind of listen to the items that they're going to discuss tonight. And we'll leave it at that. I'm confident that we can have civil discourse tonight and have a good workshop. And then from that, we'll see kind of where the work ends. And there'll be additional work later on down the line. And then at that juncture, at some point, there could be a special board meeting, another discussion to have board action. But just please know, tonight there's not going to be any votes or any action on anything. So with that, our first item tonight for discussion is the advanced professional rung on the career ladder. That'll be presented by your Director of Finance, Ms. Ebner. And so I'm going to turn it over to you, Katie, and it's all yours.
All right, thank you, Dr. Hawker.
Thank you.
Just a little bit of background as to why we're talking about the advanced professional rung tonight. It has to do with our negotiations with our Teachers Association. And we met in June, and we got a lot of work done as far as coming to agreements. However, we met this item as to what to do with revenues generated by the advanced professional rung. We came to that, and we were unable to come up with an agreement as far as what to do with those revenues. So I felt that it was really important for the board to kind of know the full story. We need to be as transparent as possible as far as all of the layers to this issue. There's a lot that the trustees have to know in order to make the right decision, ratify a potential agreement. So I wanted to take this time and go through it in depth. It's a lot of information that's built upon presentations I've shared with you each year as far as the budget, how we're funded. So unfortunately, I don't have a lot of the basics. So this is sort of like, instead of the 101, it's the 301 at this point. So we're going to go quickly. And if you have questions, please stop me. If you feel that it's not clear where I'm going with it, please do interrupt me and ask your questions, trustees. Okay, so diving in here. Of course, this is not working. Oh, there we go. Okay. Back there. Can you open that cabinet?
You want me to?
I might have to move up there.
You want me to run it for you?
I'm going to switch up there. All right, so let's start with the history of the career ladder really quickly. So it was this is a funding mechanism for the school district. The career ladder is how the school district is funded for staff salaries. It's the largest line item as far as what the state funds the school district. And so it was created to address wage disparities for teachers throughout Idaho. So there were a number of districts in Idaho that paid significantly less than districts with no local, or with a local levy. And so there were two goals. It was very simple as far as what the goal was for the career ladder. The first was bring the minimum from $31,000 to $40,000. And then the second goal is to bring the top end of the salary matrix from $46,500 to $60,000. So when the state implemented the career ladder, we met with the Teachers Association and we discussed what to do. If we were going to receive revenues differently and we pay in another way on a expanded salary matrix, what do we want to do as far as do we want to change how we compensate? And so the barrier we ran into is that district salaries are higher in most cases compared to the career ladder. So if we wanted to move to a career ladder where it's much more condensed than our current salary schedule, it would take a lot of external funding. So the state funding wouldn't quite cut it in order to switch to that method, but also keep our higher salaries. So we agreed, the district and the CEA agreed at that time to keep the way that we compensate our staff even though the revenues were changing. So we kept our expanded salary matrix with all the columns for different credits that teachers and pupil support staff earn, and then the years of experience. So over the past 5 years, the district has received increased revenues from the career ladder each year. So with the state funding to increase those minimums, the district is still going to get more revenues, even if it's not enough to fund what we're already doing. The increases in our district came from two sources. So we had more kids. Over the years, we were growing, and we also saw a significant increase from the career ladder implementation itself. These were projected and used in negotiations, and typically we would settle with awarding steps, so teachers moving on years of experience, awarding lanes, so when they earned credits, we would award movement on our salary schedule, increases on the base in a good year, and typically to cover increasing health benefits. So sort of to go into the mechanics of how did the career ladder earn us money, staff were placed on rungs of the career ladder and it came to an average salary. So every certified staff member is placed and it's a simple average, taking the total number divided by what that total was from them being placed on the career ladder. The career ladder rungs themselves increased year to year. So it wasn't just a matter of we were getting more money because people were moving up. We had staff's ins and outs that sort of evened out that. But the rungs themselves were increasing, so that generated more revenue for the district. So to demonstrate this, we have the FY16 rung values. So this was back at the beginning of the implementation. There were more steps. It went all the way up to professional rung 10. And so if you look at, let's take R2 for an example. It went from 33,200 to 34,250. So the staff members not only moving from R1 to R2 and earning that as part of our average salary, but they are getting an additional increase on top of that. So here's the difference in the rung values from year to year. So even if your staff experience mix stays the same, we're generating more revenues just based on the rungs themselves increasing. So then we look at the past, through the whole implementation of the career ladder, going up to the rung values for FY22, which is our current fiscal year. So the difference, if you take those rung values and compare to the prior year, the difference was quite high for most of the rungs, about that just under $2,000 on average for the increases on the rungs, which would increase our average salary on the funding formula. Then you get to FY21, and they don't increase the rung value anymore. So they had the first 3 rungs were increased by $1,500, and then no increases from P1 through P5. And then you see at the bottom the reason why is the state met their goal. So if you look at the far right column at the top, they're over 40,000. So they've met their goal as far as the bottom end of the salary schedule. But now they're funding the top end, so they're moving by adding those advanced professional rungs. We had ARP 1 and APR 2 this year. So, okay, there's quite a bit going on here, but this is sort of a simplified calculation of our salary-based apportionment revenues. And what we wanted to do was, like I mentioned a few slides ago, we had increases in students, which would generate us more revenues. But we want to isolate that and see, truly, is this formula earning us more if you keep students the same? So I took the formulas from all of those prior years and I plugged in the same metrics that support units, which measure our students. And so if you get to the bottom, the additional salary-based apportionment figures, you see from FY17 to FY18, the formula generated $1.2 million with students not being a part of that formula. So then going to FY19, the formula again generated just under $1.2 million. We get to fiscal year 20, 735, and then in FY21 it was low. So we're seeing the trend that we were looking at here, where our average is not increasing at the same rate that it was in prior years. So then I've added, just to have more data and have more fun, I added a column with FY22 adding in some staff members on the advanced professional rung, just so you can see if you take FY22 with no advanced professional rung and then you place some staff on that, we do see an increase in revenue. So why are these increases important? What does the district do with these new revenues? So around the time that the career ladder was implemented, we changed up the way that we negotiate. We started looking at what we were projecting as far as new revenues. We brought that to the negotiations table, and we would kind of use that as the bottom line as far as what we could afford, for those steps in lanes, movement, insurance increases, and then in a good year, cost of living raises. The projections that HR created were very close, usually within 1%. If there were higher variances, it had to do with more students, which more students cost more money. So truly, there was no hiding of the money. It was all on the table as far as these negotiation sessions. So each year, our projected new revenues from the career ladder have been significant for paying for steps, which cost about $775,000, lanes, $300,000, and again, steps is experience, lanes is staff earning education credits. Health benefits, that's an average increase for the whole district general fund, $750,000. We had a lower increase this year. However, if you take a 5-year average, it's pretty high. So we would definitely want to keep that as, a more realistic number. So you total it up, 1.8 million, and then you subtract out savings from retirees. So when retirees leave our system, at the top of the salary schedule, some making up to, $67,000, getting closer to that $70,000 figure. If they're leaving our system and we're hiring rookie staff or staff in the middle from another district with experience, there will be savings. So we always net the total of what we're working with in negotiations with that retiree savings. So,
can I ask a quick question?
Yeah.
Is the $800,000 an annual year-over savings with the changeover of staff? So is that roughly what we see every year, about $800,000?
Yes. So the question, I don't know if you have, is that we save every year another $800,000. Yes. So we calculate our staff each year and the outgoing staff, subtracting them out of the budget, adding in the new staff will generate $800,000 every year.
And
So-
that stayed pretty stable throughout the last several years.
Yes, yeah. So when we do those calculations, we find that we need about $1 million of new revenues from our salary-based apportionment. And so that's to afford, movement on our salary schedule, which already exists. That's to afford health benefit increases. And then if we want to talk about a cost of living raise, which we all know that wages are going up in our area. We know that housing costs, if you don't already own, we may not be getting new teachers into our area. So cost of living increases are always part of the conversation as potentially necessary in order to even have staff. So that adds to the 1 million. So about 1.4 million would be to award steps and lanes, health benefits, and give a 1%. And that's above the savings we have. So the question that we're always asked in our negotiation sessions are, could anything else pay for this? Discretionary revenue has increased, and it's just under that $500,000 mark every year. And we're not taking into consideration the past budget process and before, because there's been deep cuts at the state. So we're kind of trying to think of going forward, making the decisions, what's the impact on the district over the next 10 years or so. So we want to make a decision not for current, conditions, but we also want to think forward to how this is going to impact the district operations going forward. So discretionary revenue is about $400,000 each year. We also have operating cost increases. Liability insurance typically goes up. Our workers' comp insurance has been increasing. Facility issues, those can get really expensive. So it's not so easy to just say, we're not going to pay our liability insurance anymore. So the levy could be increased, but that's always a huge risk for the district budget when you are putting that quarter of your budget on the line, and an increase might be what takes someone from a yes to a no. So that's always something that we try and be respectful of and pay attention to, because risking that huge piece of our budget could be completely it'd be tough to operate. So other sources of revenue, they don't really change. A lot of them are strings attached. In the past couple of years, they've gone down with the state cuts. So sort of, going through all the different sources of revenue, we're not, able to find something else to fund these ongoing cost increases. So one question I had was the rungs are still increasing, so why wouldn't that produce enough money to afford steps and lanes and insurance and all that stuff? So our staff mix has ins and outs, and the placements are roughly the same each year. So if I weight all of our staff one year and I say they're placed here on the career ladder, and then I look at the next year, it really comes out pretty close. So the rungs also, we saw that they're increasing at less than 500 in most cases, and our steps and lanes are just under 1,600 each. So that just clear isn't going to add up as far as if it's going to fund that. Why isn't the state continuing to fund major increases in the lower part of the career ladder? Why aren't they doing that anymore, where they gave us, those rung increases? Well, you have to keep in mind that the state had two goals. It was very simple: increase the minimum and increase the top end. And so they met the minimum, now they're looking at the top end. So this is truly how we're going to earn our new revenues going forward. So with the state adding advanced professional rungs, we will, that's just going to be the way that we earn our new revenues as a district. This is our biggest piece of revenue as a district. So that's how, how the state is choosing to fund. It's those top rungs of the career ladder. again, we need about $1 million for sort of the things that it's really tough to settle in a year when you're not doing steps and lanes and insurance. So we've had that experience. Staff, they pay to earn their credits, so they pay that in with the expectation that it's going to move them on the salary schedule. So truly, I understand why it's difficult to settle in a year when you're not able to do those things. And then again, the 1% increase is something that we have to keep in mind, that we may not be able to just get by with those basics, where, you know, we may have to look at cost of living increases when the district budget stabilizes, when the state reinstates funding. And then so sort of the crux of the issue is, if we are being asked in negotiations to divert this new revenue directly to staff members who earn the designation of advanced professional, we are taking that funding stream that's the way we're going to generate new money, and we're giving it directly to individuals rather than having it to being able to afford what we need to in our budget. So, questions and answers for the board.
Katie, I just had a quick question. So the funding that's available for the terminology for the certified, oh, can you hear me okay?
Yeah.
Is that the 350,000, or the lanes is 300,000? Does that count for those staff members that are going on and getting additional certifications and training?
Yes.
And is that separate then from the steps?
Yeah, so
Okay.
steps are years of experience, and then the lanes are if they earn certain credits, totals. So I have the salary schedule right here. So a bachelor's degree is the first column. A bachelor's degree plus 10 credits would get you to the next one, and then it goes to 20, 30 additional credits, 40 additional credits, 50 additional credits, 60, and then 70 is the very last column. And then having a master's degree can earn you more as well, a doctorate degree. And then there's longevity for staff members who have been here more than 15 years. So.
Okay, thank you.
I think at some point I'd like to understand what the teachers are being told on their side as well. That would probably just help as we go into negotiations. Oh, thanks. Oh, yeah. I think what I'd love to understand a little bit more is what the teachers are being told on their end before they apply for and go through all the work to achieve, you know, their advanced kind of things. And so, because I think as we go into negotiations, that there's just a question there that doesn't fully make sense.
Yes, so we're working on getting the word out as far as what qualifies you for being on the advanced professional rung, what what needs to happen as far as getting placed there. And then just, I didn't mention this, the last offer from the district, I believe, was half of the additional revenues generated. So there is some extra compensation involved here for those staff members, because if they are doing the extra work to get on the advanced professional rung, we want an incentive, because that also increases our district average, and they're doing more work, so there should be a financial incentive.
Okay, thanks.
Katie, can you speak a little bit what the advanced professional rung means and what is required for teachers to go ahead and get that certification? And then who is the determiner, who makes that determination if a teacher has reached? Because I think that's also part of the confusion, is what is the process, who would make those decisions, and how would they apply if they were to go that route?
Yeah, so Eric is the expert here, and I think I should probably hand you the mic.
I think just generally, what % of our staff would qualify for these funds?
So Lisa, what we're looking at is approximately, this is a multi-tiered process, and if you don't make any of the tiers, you don't qualify. The first tier is simply, you got to be teaching for 8 years with a professional certificate. This is more than, you can only get your professional certificate after your first 3 years. So this is for really seasoned teachers. That is the first level that you got to look at, and we've got about 300 to 350 teachers who meet the first level criteria. Okay, then after that, we start taking a look at their ratings, the goals that they meet, their individual learning plans, and it'll get down to somewhere between 50 and 100 teachers probably could qualify. We've submitted the paperwork to the state already for this coming year. They will probably get back to us between September and October to see how many teachers actually do qualify. It's a combination of their effective teaching is to be determined by how many, they've got to meet 75% of their kids meet certain standards on certain test applications. They have to receive distinguished ratings in at least 2 critical educational domains. In other words, they're doing a better than average job. And then they have to be in a district leadership role for 3 of the past 5 years as well in order to qualify. So there's quite a few things that they have to do. Most of them that could qualify are doing those. It's all about, how well they're doing them. And that is a pretty objective evaluation. It's not subjective. The last thing is that anybody that qualifies, the district will send a letter and say, yeah, these people are certified for that wrong. Does that answer your question?
That was perfect, and I just saw the handout that you had given us, so thank you. To that end, though, are staff getting any of these funds right now if they're qualifying and you're submitting their names to the state, since we're using those funds in a general pool? Are they eligible for additional funds?
So last year was the first year that this was implemented, and they implemented it late in a COVID year. A lot of the districts, did not get this implemented in time. So this was the first year that we have submitted for this. We will not know, how many teachers qualify, and since we haven't completed negotiations, what they would be actually eligible for. And it is a sliding scale too. It starts at $2,000, and every year that it can maintain it, it can go up to as high as $12,000 per teacher that qualifies, and that's kind of what we're working with right now. The top rung there. Can you hear me now? All right. So it doesn't sound like it's on to me.
It doesn't sound like it's on.
Okay.
I have to hold it closer, Casey. Just take it out. It'll show this little red light going. You push on the bottom.
All right.
You have your red light on here. Let's just.
Okay. The top rung, or the 12,000 on the advanced professional rung, that's after how many years?
That is a
again?
really good question. It's after 5 or 6, I think. Hang on, she's got it. 5 years.
Okay. And then what's the big difference, or I guess I know this because of 6 years on negotiations, but when you look at our salary schedule, which I think is spread over 15 years of service, plus there's some longevity bonuses after that, 20 years and 25 years. But the career ladder is over 7 years, is that correct? So not including the professional rungs?
The
7 or 8 years?
It's yeah. Go for it.
I have it up. So 3 years on residency, and then professional is 5 years, and then you can go up to 5 years on advanced professional. And I think I know what you're going to ask because I almost put a slide in, but the very top of advanced professional is $63,000. Currently, our very top is $66,482. So we are above even the plans for what the state's going to do. And beyond the $66,482, there are a number of different stipends that can be awarded. So we see, a teacher that's made it to the top and they've got all the stipends are more towards the $70,000 a year. So we will, be above what the state has.
So on our salary schedule, that first top left corner, which is, first year teacher, bachelor's degree, they're at the state minimum of 40,000. Is that correct? Or
Correct.
whatever it is
Yes.
for that year.
Yeah.
And then as we move in our columns to the right and down, we increase away from that state minimum funding mechanism, right?
Right.
So the spread gets bigger. We're
Right.
paying more than what the state's allocating for those folks.
Right, and it is directed more towards experienced staff. You know, if you're at the lower end of our salary schedule, you're going to be closer, if not right there with the state. So,
Thank you.
Thank you very much, Katie, for presenting this. It certainly has helped me. I don't have any questions, but obviously a lot of them were answered just through the slide, and the handout today was helpful as well, and what that advanced placement or professional endorsement means. So,
Better question, Katie, maybe you can, we haven't heard from staff how they feel about this yet, because I know it's so new. Do you guys have a sense? I know the negotiation team might have some sense of those people that have been in that process, but generally speaking, staff at large, is it something that everybody understands, or were we planning on getting out into the schools this year and talking more about it?
yes, I'm not aware of widespread knowledge of this. I know that the CEA, they work with staff and kind of reach out and, you know, cover that end of things, but I do think it would be valuable for staff to know sort of what what position this puts us in if we choose to go the route of making it completely pass through. You know, I'm hoping to be with the district for many years, and in 10 years, or you know, even in 2 or 3 years, if I say, uh-oh, we can't afford, you know, what we settle with each year, I don't want that to be a surprise, for sure. And I think that shouldn't be a surprise for staff if that's the route where we end up. And I think the majority of staff won't benefit from this change for quite some time. So that's one thing to keep in mind.
well, it would strike me, along with what Trustee May said, that maybe even your slideshow would be available and maybe part of some school-wide meetings and brief little snippets of what Katie has shared, and then folks can obviously reach out with more questions.
Yes, of course.
So, okay. Well, that brings us to our next agenda item, which is our reopening plan for 2021-22 school year. Dr. Hawker.
Thank you. I'll try to not use a microphone. I think I can talk.
We need it for the people streaming.
The ones on the...
Sorry.
All right. Okay, yes, the next item, our reopening plan as well. I would suspect that that's why most everybody is here tonight. And you can see as well that just even looking around the room and stuff, this is a topic that has had both sides share out lots of viewpoints. And I think that's very important. In my 45 days or so here in the district, I absolutely have learned that you know, there's always two sides to every discussion, and that's absolutely evident in regards to some of the strategies that this district has implemented in the past when it comes to COVID. One thing that I have found that's a common, although there's definitely different viewpoints, the common is this, and it's something that I absolutely get excited about supporting as well, and that is that both sides of that conversation, wherever you happen to fall, are extremely interested in maintaining and keeping the schools open. That is extremely important. Granted, online learning is an incredible opportunity for many kids, but definitely not all kids. And so I think this next section, as we work, this is going to be the kind of the meat of tonight's workshop. The next couple of items, I think I'm just touching on those for a few minutes apiece. But tonight's workshop is meant for you to do just like you did with the last topic, ask a lot of questions. We're going to do our very best to answer them. We have, I'm going to turn the time over to our school nurse, Nicole Pekarski, here in just a minute. But I just want to reiterate, we're going to get to hear from a healthcare, what do I want to say? A leading voice in the state of Idaho, in Boise, to just get help us have a picture of kind of what's happening. And then we will share out some information that's very pertinent to our local area right here to help the board as well. and then go through a whole list of everything. Because obviously, as your superintendent, my task, of course, is to lead an effective educational program for all of our students and provide the very best opportunities that we can for each and every student. And that's really going to it's really going to come to press upon this group as we work through and come up with avenues and opportunities to, like I said, keep our schools open and let us have a successful year so that parents and students are not having to kind of go through what we've all had to go through in the past. And so I know there's a whole lot of discussions going on out there. I know there's a lot of conversations about the posted draft reopening plan, and I can't reiterate enough, as I said at the last board meeting, that plan that's on the website is simply capturing where we're at as of that last board meeting, and to meet the guidelines that is so important for this district to meet at the state level, so that those federal funding dollars continue to flow to Coeur d'Alene School District. That's really important. So we've done that, and we've met those criteria. Now we've got to continue working on our plans and find what's best. And as I've also said in the past, if anything that we have learned from last year and all the resiliency and all the trials and errors, that is that everything with COVID is always in flux. And so decisions and plans that the board may put together last month might need to be different the next month. We honestly just don't know, because I think that's the commonality here, is the unknown. So with that, let's go ahead and start. We will have an introduction of the speaker that will be presenting through Zoom. She couldn't be here tonight, but at least we'll be able to listen to her through Zoom. So hopefully we'll have good sound and everybody can hear, and then we'll go from there and hopefully have some great discussion. So with that, I'll turn the mic over to you and let you kick us off. Does that sound okay? All right, thank you.
Can you hear me okay on this one? Okay. Thank you. Chair Brumley, members of the board, Dr. Hucker. I am Nicole Piekarski, registered nurse and director of school health for Coeur d'Alene Public Schools. This evening I am pleased to introduce to you Dr. Christine Hahn. Dr. Hahn is the medical director for the Idaho Division of Public Health. Dr. Hahn has been working with the medical leadership at Kootenai Health locally to provide busy medical providers with the tools they need so that they and their patients can be successful. Dr. Hahn is known statewide for her common sense approach to often challenging situations. And Seth, I spoke with Dr. Hahn earlier today. She'll want to be able to share her screen. And Dr. Hahn, go ahead. Dr. Hahn, did you hear us?
Yes, can you hear me?
Yes, we can hear you great now. Thank you.
Okay, I'll just shout more. I apologize. Yeah, I get a message that it's disabled.
Go ahead and give that a try, maybe.
Okay. Oh, this looks more promising. Okay, let me know when you can see it.
We can see it. Go ahead.
Okay. Hey, thank you so much. And I do apologize. I'm down here in Boise. I do love Zoom, though, that I'm able to still be able to talk to you all without the travel. So I was asked to maybe just provide a statewide perspective, from Idaho. As you know, I'm at the Division of Public Health, which is part of Health and Welfare. So we're the one of the smaller pieces of Health and Welfare is the Division of Public Health. And we've been, of course, working very closely, as Nicole already mentioned, with Kootenai Health, with others around the state to try to keep hospitals open, to try to keep kids healthy. So I'm going to just start off with some, I know we have folks available today too that are from Kootenai Health that I think are going to be some powerful voices for you to hear. But I'd like to talk a little bit about just what's going on in the country and why we're concerned for this fall. And I'll also preface it by saying I have 2 kids that started school today. So I'm very sympathetic and aware of the concerns that parents have as they want their kids. My son did online school last year by his choice. My daughter did hybrid. So I feel like we've been through it all. I'm so excited they both were able to go in person to school today. And I wish the same for parents, all parents. So, first of all, of course, I think you're all well aware that this is the national data showing the number of cases in the United States. This here was our peak last winter in cases, and then this is where we're at now. So, just very concerning. If you look back at August of last year, we're actually quite a bit higher than we were a year ago today as far as numbers. And I'll show you some Idaho data as well. As far as hospitalizations in the United States, you can see here nowhere near what we saw last winter at this point, but hospitalizations and number of hospitalizations are rising. This is the number of people who are occupying hospital beds for any reason is important, but this is really patients only with confirmed COVID to really show that that is increasing quite a bit. Of course, these are almost all adults, but we'll focus on kids as well. So this is the latest news that has come out, which is that we actually are seeing nationwide more kids being hospitalized now. So you can see here, still a low number. I want to point, I hope this isn't too small for the screen. This is looking at all age groups, and you can see kids are not nearly as likely to end up in the hospital as adults by any stretch. But nonetheless, it's concerning that we are seeing a rise in those kids being hospitalized around the country. And I'll talk about why I think that's happening in a second. So looking more specifically at Idaho, you can see here the same, this is a CDC data, and you can see here looking in Idaho, again, we're seeing the same thing. We're seeing hospitalization rates go up, mostly among seniors. You can see the maroon color here is people 70 and older. So we are seeing a bump in the hospitalization rates. Nothing like what we saw last winter, but we are seeing a bump. And you can see here looking at our kids, so far, no evidence of a rise like what we saw last winter. But again, remember, our numbers are small. We've only had, according to CDC, 151 total admissions of kids. That's a lot of kids if that's your kid or kids in your family or your neighborhood, but nonetheless, nothing like what we're seeing in adults. Our data, we're always a little bit ahead of the CDC. We've recorded 175. If you go on our state data website, we've recorded 175 children hospitalized throughout this whole pandemic. So focusing in a little more, you can see here, this is off of our website. If you go to coronavirus.idaho.gov, you can navigate to our data that we display daily and update daily. And I wanted to show you our case count here. We had 813 cases reported today, which is the highest we've seen really since the winter. And compared to August 17th of last year, we were looking at 280, and we were actually still on a little bit of a downward trajectory from our summer peak. So really, I'm worried that we're ahead of where we were last year as far as seeing a rise in total cases. As far as hospitalizations in our intensive care units, you can see here again, this was last winter's peak in hospitalizations. This is all age hospitalizations. But look at what's happening now. The steepness of this curve is much steeper than what we saw last year with this gradual increase. Same with intensive care unit. We now have in Idaho, as of today, 108 people in the intensive care unit. So again, very concerning rapid rise in our cases in the hospital. On ventilators, every day it seems to be going up, and we learned our latest data is that we have 60 Idahoans right now on ventilators due to COVID. Now this chart only goes back to June, so it's not showing the winter peak, but really making the point that really since July, this was kind of a lowest point that we got to, where we had 10, 11 people on ventilators, that this rapid rise has occurred just through July and the first half of August. So very concerning increase. And importantly, and some of you may have seen this graphic, we put this out through social media, through press releases, but almost all the patients in the hospital right now due to COVID are not vaccinated. Not always, they couldn't always be vaccinated. We know that children under 12, for example, currently there is no vaccine for that age group. Other people may have a medical reason they weren't vaccinated. But nonetheless, if you look at our recent cases, this is starting with May 15th, the fact is that almost all of them are not vaccinated. That's true for cases, that's true for hospitalizations, and that's true for our deaths. So very concerning, especially since we have a large number of unvaccinated folks in the state. When people go and get COVID testing, maybe they've got a cold, symptoms, maybe they've got a cough, maybe they've just been exposed to somebody. Our percent, we track how many of those tests come back positive. And wasn't that long ago, mid-June, that we were like, wow, only about 3% of those tests, when people get tested, come back positive. That percent positive is what's tracked here on the left-hand side of the curve and the blue line. And you can really see here how low we got. And then it's just gone up and up and up every week. So now we're over 12% of our total tests. When people go in and get tested, 12% of the time they're positive. Whoopsie, sorry about that. So how does that look statewide? When you look at the positive tests, it varies by county, but some of the northern counties in particular have got high rates of percent positivity. We also have some of that going on in the southeastern part of our state. It's certainly not confined to one part of the state, and it bounces around a little bit, but we do see some areas where we have more positive tests than other parts of the state. So you all have heard about the Delta variant. We are concerned that that is one of the main explanations for why we're seeing such rapid rise in cases. This website is called Our World in Data. I urge you guys to look at that site if you're ever interested. They have data about all sorts of things, not just COVID by any means, not even just health data, economic data, and others. And what they are doing here is they pull data from all sorts of countries. The green line here that I'm tracing is India's rise of Delta that we saw that was attributed to the large surge that India had over the winter and spring. And you can see here how the United States has risen rapidly. Canada is on the rise, United Kingdom, all seeing more Delta cases. So why do we think Delta is so different? It can be argued whether if you or I get infected with Delta, if we're more likely to get sicker. That is controversial. Some studies have suggested yes. Some have said no, it looks about the same. I'm sure that the science is a messy business. We all know that we see studies that contradict each other. That is part of what science does, is we never jump on one study and say that's the absolute truth. We look to multiple people to look at this information. And what we see, though, consistently from almost every country that has looked at the Delta is that instead of infecting one or two people like the original COVID strain did, it appears that the average patient infected with Delta actually infects 5 or 6 other people. So that means that that doesn't sound like a huge difference until you start multiplying. This guy is going to infect 5 more. This guy is going to infect 5 more. And if you have those folks getting sick 5 days later, getting sick 5 days, or infected and being infectious 5 days later, very rapidly you see outbreaks occur much more quickly. So this infographic that I really like from CDC, I think is the simplest way of thinking. Why is Delta more different? It is more contagious, and that seems to be clear from study after study and report after report. So if you have more people getting infected, even if most people will do fine, you are going to end up with more people not doing fine just because there are more people infected. You're going to end up with more people in the hospital. It's just a matter of percentage of people getting sick. And I think we're starting to see that, as you saw in our rapid increase in hospitalizations in Idaho. Our data also shows that most of our viruses now are Delta. So we know it's here. So the other half of this equation, of course, is vaccinations and immunity. We know that vaccination rates in Idaho are lower. This is a CDC state-by-state comparison of vaccine rates. And you can see here of doses per 100,000 people. that we are in the lower end of that with really fewer than 100 low rates of vaccination compared to other states. The other area with such low, we are 46th in the nation right now, and the other states with really low vaccination rates are the Southeast, where we are starting to see outbreaks already. What about by county? Our vaccination rates vary quite a bit. I think we all know the highest rate is in Blaine County. They have a very high vaccination rate they have from the beginning. If you think back to over a year ago when this all started, Blaine County, you may recall, got hit the hardest. They got hit early and hard, and it devastated their tourism industry. I think there's been a strong commitment to trying to keep their economy going, get the folks vaccinated, and they have a very, very high vaccination rate right now. After that, Ada County and Valley County both have relatively high vaccination rates, and Teton County. But you can see here how it varies throughout the state. This is among people who are 12 and above, so those are all people who are right now eligible to be vaccinated. You can see it varies greatly throughout the state. So I will wrap up my remarks with some of my concerns. I'm very worried that we are already seeing a rise in our cases, a rise in our hospitalizations, and that it is earlier than last year. In addition, even though we have the vaccine, which I think is going to be very helpful in hopefully preventing deaths, especially in our seniors who are most vulnerable, of course, to dying from this virus, our numbers aren't where we need to be, certainly to get herd immunity. We also think we haven't had enough natural infections to get herd immunity. And we also know now that natural infections, like vaccines, aren't 100% protective, and we have people getting reinfected and getting sick again who've had it before. So we've had more positive tests for COVID. We also know that we are all tired of this virus. We're all tired of masking. I notice as I go to the grocery store or go to public places that some people are wearing masks again in public settings, as the CDC recommends, but others are not. And I think that people are just tired of it. So what that makes us worry about is not only are we going to see, as kids go back to school, as we all go back inside and we don't have as many outdoor opportunities to eat at outdoor restaurants, to recreate outdoors, that we're going to see not only SARS-CoV-2, but influenza, which really was mild last year probably because of people socially distancing, masking, some school closures, business closures, things. But we believe we're going to see influenza come back, and we have already seen respiratory syncytial virus, or RSV, coming back. This data is off our website showing RSV test positivity also rising, and this is really unusual. I think you'll be able to hear from some of our pediatricians that are on the call with us today that they're already seeing RSV cases in the hospital. This is a virus that usually does not hit us in Idaho until November, December. And this is happening around the country that we're seeing RSV. So we're very worried about those combination of viruses, along with the other things that make people sick, heart attacks and strokes and other things, starting to overwhelm our hospitals. And that's really what we are concerned about. So what are my recommendations for keeping kids healthy, keeping kids in school, keeping schools open? First of all, everything we can do to try to get folks vaccinated. We know that there are still, through opinion polling, we still know there are a lot of Idahoans that are open to vaccination, but just haven't gotten them yet. Maybe they haven't thought it was bad enough, or haven't just have been wanting to talk to their doctor, have been waiting for more people to get vaccinated and get more confidence that it is safe. The evidence is growing that for most people, this virus is much more dangerous to them, much higher health risk than any risk from the vaccine. No vaccine is risk-free. I'll never make that argument. But that is why I've gotten vaccinated. That is why both my kids, who are teenagers, have both gotten vaccinated. I think that it has, we all did well with it, with the vaccine. And I am a little less worried about them this fall as they go back to school. Also, I recommend working with our pediatricians. We know many parents, we don't take it from me. They don't want to hear it from the CDC. They want to hear it from they want to talk with their pediatrician or even their pharmacist, others in their community. So we need to continue to make sure pediatricians, pharmacists, others in your community have the right information and are able to talk to parents about whether or not they want their kids vaccinated. I strongly encourage schools to, I have not seen, and I apologize, again, I was just asked to speak at your meeting late last week, and I should have taken the time, and I have not been able to yet look at your plan for reopening. But I do encourage social distancing and masking per CDC guidelines wherever feasible. Nothing's 100%. We know the virus spreads by respiratory droplets and droplets, not to zero, but they help. Also, I recommend that schools do notify parents of potential exposures in school settings. If there's a kid or a teacher or anyone diagnosed with COVID, parents should know about that. They should be able to be aware that their child was possibly exposed. I think that means that they can choose to get their kid tested, or they might keep their child home from school if they're worried about it. So I do strongly recommend notifying parents of exposures. And then lastly, you may have heard the governor announce last week free testing available. The governor is announcing a plan to make $30 million of testing available to K through 12 schools. That includes staff, including teachers, it includes kids. It can even, if the school would like, include family members if the school wants to implement that type of testing. That will really help keep kids and families safe, so parents know if there is COVID in the school or in their child's classroom. So that concludes my presentation. I know there are some other folks that may have some good information to share, and I know we want to have time for questions as well.
Thanks for the lies.
Excuse me. I want to warn everyone in this room right now, if there is another outburst, you have the ability to watch this meeting online, and I will remove individuals from this room who are disruptive and disrespectful to our speakers. You are going to hear many, many comments tonight. Some you will agree with, some you will disagree with. You do not have a right to have an outburst, yell, say anything. You have had an opportunity to give this board your input. We had public comment at our... Sir, you get one more time and you will be removed. This is not your forum. This is mine and this board. You do not get to interrupt what we are doing. I understand that this is a very passionate and explosive topic, but I demand respect for everyone's opinions in this room. You can absolutely disagree, but you do not get to be rude and disrespectful and interrupt.
Lying is disrespectful.
Sir, I'm going to ask the officer outside to have you removed.
If he's going to be removed, thank you a lot for all your lies. And the children.
I appreciate everyone else. I hope you can understand that this is not about me trying to restrict anybody's opinion. I simply just want to hold a workshop so everybody can hear what the board has to say about this topic. But this meeting is supposed to end at 7. And so if we run out of time, then I guess the public doesn't get to hear from the board. And those kind of outbursts are not going to get us to the end here on what we need to have happen. So Dr. Hahn, I appreciate your time. I assume you're still up there. I don't know, do any of our board members have questions of Dr. Hahn?
Dr. Hahn, are you still able to hear us?
Yes, thank you.
Thank you for your feedback tonight. You made some comments in your presentation about all of us wanting to get kids back in school full-time in person, and you gave us some examples of how we can be successful. Can you talk more specifically about mitigation strategies and what are the most important strategies that we can implement to be successful at getting our kids back in school on the first day and keeping them in school? Because I know that one thing that we can all agree on here tonight is that we want to see as normal a school year as we possibly can.
Yeah, thank you. And I did say this before. And again, I speak, this is my public health knowledge and my infectious disease, I don't think, I mentioned again, I'm an infectious disease physician by training. That is my professional training. I also speak as a parent, and I would say I think the most important things we can do to keep our kids in school are, number one, if they're vaccine eligible, and to have our staff and our visitors and our kids that are eligible vaccinated. As you saw, the cases, the hospitalizations, they are mostly unvaccinated people. No, it's not perfect. No, it's not 100%. No vaccine is, but that is super important. The second thing is masking, and I heard, I think that's what prompted the outburst. I've been working this. I've been working in public health for 20 years. I understand that not everything public health recommends is like I said, people can disagree. But my professional and personal opinion is that masking is helpful in reducing virus. In fact, I think it's amazing how much the mitigation measures that were put in place last year knocked flu down. I've been trying to fight flu for 20 years. I've never seen anything like it. It's been, and I think some of the other doctors that you might hear from later will agree, I've never seen such a mild flu season. And I think the masking had something to do with that. So I think those are the most important, but I think there are other things that schools can do and should be looking at, just trying to keep outdoors, outdoor activities as much as possible. I know that there's times in the winter that it's not going to be possible. Ventilation where possible. Buildings can use HEPA filters and do filtration systems, like airlines do. We all benefit from being on an airplane because they filter that air. And that's not magic. That's something that I think more schools should look into, is having good ventilation systems and having those evaluated. Of course, I don't know what your schools have done, but I think that's another important thing. And then, of course, there's old-fashioned hand washing and that type of thing, disinfection. But I think those are lower on the list. I think they're always important. They're just good hygiene. But I think for this virus in particular, it spreads through droplets, and that's what we need to focus on.
Thank you, Dr. Hahn. I had two questions about some of the information you presented there. One was just about vaccination rates in general. Can you just speak to what's happened in Idaho over the last month or so? I think I saw the number of vaccinations per week has increased recently.
Yeah, thank you. I had a slide on that, but I really didn't want to go over time. We have seen an increase in vaccinations really since starting in July, especially in our younger population, including young adults. I'm not just talking 12 to 17-year-old, but even adults. I think some of that is kind of back to school, which I was really excited about. I've really been encouraging parents, hey, a lot of you got to take your teenager in anyway to at least do maybe a physical, or even talk to your doctor about some of the other vaccines that are recommended for teenagers. Talk to them about the COVID vaccine. So I do think we're seeing a bump partly because of back to school visits to doctors, but we're also seeing it across the board. And I think news about the Delta, news about the incredible number of people getting sicker from other states has maybe spurred some people to say, hey, I think this is the time I'm going to go get vaccinated.
Okay, thank you. My other question was just about a slide you had in there about the Delta variant, and you showed a couple other countries, UK and India. And it showed a peaking in those countries. And so can you speak to that a little, kind of what happened there and what the projections are for the United States in that regards?
Yeah, that's a great question, actually. We actually look at this site a lot because we'd like to see what's happening in other countries. And I found our World in Data site very helpful. In India, there was a big surge of Delta, but then it dropped off. In the United Kingdom, it has dropped off almost to baseline, and it's being replaced by other variants. In the United Kingdom, it has come down, but their rate of Delta is still pretty high. So it's a little too early to give a final call on the United Kingdom, but this is, as I think it was actually Dr. Hocker mentioned, the one thing certain about this virus is that it is not something we can predict. So there is a possibility that we'll see Delta go away, and be replaced by other viruses, or even that we'll see COVID drop down in the next weeks or months. That's not what most experts are predicting. They're expecting it to go up further in the next few months, but we don't know.
Dr. Hahn, thank you again for being here. Could you speak, just for my own clarity as we enter into a new school year, you shared some numbers just about children and COVID, and just you said yourself that there was some low numbers. Could you speak a little bit more to that for us, and then why we need to re-implement measures within our schools if children are really not getting as sick?
Yeah, thank you so much. I think a couple things. Looking nationwide, I showed you that increase in kids being hospitalized, which we have not yet seen in Idaho. I hope we don't ever see it in Idaho. But about right now from the CDC, the statistics are about 2.8%, so a little under 3% of hospitalizations right now are kids. Again, I think no parent wants to see their kid in the hospital, for any reason. So we want the kids to be protected, but we also want the teachers and we want the kids' parents and we want others to be protected. When we're in a community and we're all trying to stop spread, we're trying to, we're trying to see if what we can do at all levels. I wear a mask to the grocery store now. I'm vaccinated. I'm not doing it because I'm scared. I'm not doing it because I'm worried that I'm going to get super sick with COVID. I feel protected, but I don't want to be able to spread it. And whoever's doing the hand gestures in the background, please, that's not respectful. Thank you.
I apologize, Dr. Hahn. I did not see the individuals behind me, but I would ask that not happen again, whatever it was. I have a question, Dr. Hahn. You talked about hospitalizations, but I haven't heard any mention of child deaths. Has there been an increase in child death? Has it stayed rather static based on the statistics from when COVID started?
Yeah, thank you. I'll be super clear. We have had, and I can't tell you how happy this makes me to say this, we've had no child deaths in Idaho from COVID. What we have had, though, is 29 kids hospitalized with that inflammatory condition, which has made them super sick, a condition that can affect the heart, the liver, the lungs, and we don't know what their long-term health consequences will be. So there have been deaths around the country due to COVID in children, but it's very rare. We're more worried with the kids about that inflammatory condition. They can get long COVID, and we don't know what the health risks will be. People talk about we don't know what the vaccine will do. Absolutely, it's a new vaccine. I totally accept that. Life is, risks, and I think the risk of COVID for kids, we don't know. The kids that recover from COVID, we don't know, especially more severe cases, we don't know what their long-term risk will be.
Okay, Dr. Hahn, it doesn't appear that any of our board members have any other questions. Thank you very much for your time this evening and joining us. I know you're an hour ahead of us, so thank you for taking some time out of your evening. And I'll turn it back over to Dr. Hocker.
Sure, thank you.
Yes, we were able to speak, Dr. Hocker and I were able to speak with several physicians this afternoon at Kootenai Health, as well as the health department, and receive an update on the situation in our community. And so we've been asked to share that information with you this evening. We all agree that children need to be back in school with their friends and teachers. Dr. Sonia O'Leary of the American Academy of Pediatrics says the pandemic has taken a heartbreaking toll on children, and it's not just their education that has suffered, but their mental, emotional, and physical health. Dr. O'Leary believes that schools can safely reopen to in-person learning by combining the layers of protection as recommended by the U.S. Department of Education, the CDC, and the American Academy of Pediatrics. Children and adolescents can be infected with SARS-CoV-2. They can get sick with COVID, and they can spread the virus to others. We heard Dr. Hahn speak about many studies that show children in the United States get COVID just as much as adults between the ages of 18 and 49, and children ages 5 to 17 actually get COVID even more than older adults ages 50 and up. Early in the pandemic, several studies suggested that children and adolescents had less cases of COVID infections than adults, but they were wrong. The lower numbers of infections may have been due to closures in schools, daycares, and activities. and a lower probability of being tested. Since that time, studies testing children and adolescents have found their rates of infection are comparable. Yet some children are less likely to develop severe illness or die from COVID-19, yet some children are hospitalized and some have died from COVID. Dr. Hahn spoke about our Idaho statistics, and we know that specifically in the Panhandle, 23 children have been hospitalized with COVID. The extent to which children will suffer long-term consequences of COVID-19 on neurological, lung, metabolic, and cardiovascular function are still unknown. The current COVID outlook for our community is not good. The state of Idaho is expecting to surpass previous record numbers of cases and hospital admissions by mid-September, and mark new records of cases and hospital admissions each day through the middle of October. Kootenai County is on track to do the same. In fact, Kootenai Health is expecting us to surpass new records this Friday. The positivity rate of Kootenai County is 24.2%. It is nearly 5 times what it was in the first weeks of July. The data that Dr. Hahn was able to show from the state website is weeks behind. The 46 cases per 100,000 7-day rolling average that Kootenai County is currently posting is 4 times what we were in July. Our local hospital status has been at capacity for 18 months. The number of COVID inpatients has dramatically increased in the last 3 weeks. Today, Kootenai Health reported 80 COVID inpatients. Their previous all-time record was 91 patients in December. Kootenai Health anticipates they will add those 11 patients by this Friday. Kootenai Health also asked us to share with you that they have only 26 ICU beds. They currently have 32 COVID ICU patients, and they've had to retrofit other units to be ICU beds. These ICU beds are needed for patients in car accidents, strokes, heart attacks, and head injuries from things like baseball games. Our community continues to need health care outside of COVID. These numbers we're seeing are very similar to what we saw in November and December of last year. The school district had a difficult time keeping some of our schools open from November through February because of illness in our staff, students, and families. On August 3rd, Governor Brad Little said we need more Idahoans to choose to receive the vaccine if our kids have a chance at a normal school year. Governor Little said it's important to protect children and their ability to learn without interruption, and the way to do that is by more Idahoans getting vaccinated. New cases are rising dramatically in Kootenai County because of the Delta variant. The physicians we spoke with at Kootenai Health asked us to share with you, please respect the Delta variant. It is different. They asked us not to dismiss this COVID. Dr. Catherine Turner of Idaho Department of Health and Welfare said the Delta variant spreads faster and more easily than previous versions of the virus. Dr. Turner said that the 0 to 11 age group is Idaho's most vulnerable population because there is no vaccination for them. The number of cases in Idaho across all age groups has doubled this month. The Idaho Director of Health and Welfare, Dave Jepson, said health officials are worried about what will happen when cold weather settles in. Kids return to school and people stay indoors. In the first week of August, only 15.4% of Kootenai County youth ages 12 to 17 were fully vaccinated. Governor Little is calling on Idahoans to get vaccinated against the virus. The vaccine is available for those 12 and up. It is safe and effective, and the side effects are usually very minimal. Kootenai Health asked us to share with you that if you extrapolate some of that data, for example, knowing that the positivity rate in our community is 25%, if we tested 11,000 children in our school district, 2,500 of them would have COVID, and 1% of those would require hospitalization. This is a low number, 1%, but that number is 27, and Kootenai Health cannot care for your children. They do not have 27 pediatric ICU beds. Students requiring hospitalization will need to be sent to Spokane, and when Spokane is full, they will be sent to Boise, and they will be sent to Seattle, and anywhere else they can get your children. Significant transmission of COVID is documented in school settings where prevention strategies are not implemented or are not allowed. Although outbreaks in schools can occur, multiple studies have shown that transmission within school settings is typically lower than, or at least similar to, levels of community transmission when prevention strategies are in place in schools. And we found that very same information here in Coeur d'Alene Public Schools last year. When our students were masked and socially distanced, all of our grade levels experienced COVID incidence rates that were similar to the county rates. When our students were no longer socially distanced, for example, when our secondary students went from hybrid to 5 days a week, we experienced, in our secondary schools only, increased incidence rates among students and staff. We found that consistently through the year, K-5 students and staff had similar rates to COVID, similar rates of COVID to the county. Mainly, we believe, because students were able to be socially distanced in pods, if not from each other, but small groups of students were distanced from other small groups of students. And so when our district went unmasked after April 21st, we saw that those students who were not able to be socially distanced and staff had an increase in COVID rates. The U.S. Department of Education recommends high-quality education in a healthy and safe learning environment. Everyone 12 years and older get vaccinated before school begins. Districts should make a plan to prevent COVID from spreading at school and connect students and families to nutritious school meals and help students and families access safe transportation to school. The CDC recommends full-time in-person learning, universal indoor masking for all teachers, staff, students, and visitors to K-12 schools regardless of vaccination status, and implementation of layered prevention strategies. The Academy of Pediatrics strongly recommends in-person learning and urges all who are eligible to be vaccinated. They also recommend layered approaches to make schools safe for all students, teachers, and staff. Everyone older than age 2 wearing masks regardless of vaccination status. School districts should have plans for building ventilation, testing, quarantining, cleaning, and disinfection. The Idaho Department of Health and Welfare, in a joint task force with Idaho education stakeholders just today, recommended the same CDC strategies for all Idaho schools. It is true that we do not have the resources or perhaps even the community support to implement all of the recommended protocols, but it is also clear that we must do something to prevent the spread of COVID in our schools and protect our students, staff, and families. Idaho statute, section 33.512, states the duty of the board to exclude from school those that have an infection or that have a known exposure and are not yet immune to COVID. IDAPA codes clearly state the school administrators and school nurses must report diseases and conditions to the health department or face penalties that may include fines and imprisonment as specified in Idaho code. Also stated in IDAPA is that anyone who's diagnosed with or reasonably suspected of having COVID, that would be someone with a known exposure who has developed symptoms, must not attend school while contagious. Unfortunately, we do not have the staffing to perform contact tracing this year. We will not be able to provide this level of safety to our students and families. Furthermore, the health department will not be able to provide us with contact tracing services either. The health department has one contact tracer for all 5 northern counties. We must act in other ways to protect our students, staff, and families. We have a clear obligation to our community to provide in-person, face-to-face learning in a safe and healthy environment. To do nothing would be reckless. The danger is well known to us and measurable. The risk is clear. As a local leader, please listen to the experts, implement layered protections, make a plan that will prevent the spread of COVID in Coeur d'Alene schools. Thank you.
Nicole, I missed what you said you said somebody was recommending masking for all Idaho schools. What was that entity?
Idaho Department of Health and Welfare formed a back to school task force, and those documents were released just today. Would you like to know the constituents on that?
No, that's okay. I just didn't hear who the entity was. Thank you. Questions for Ms. Pekarsky? Thank you very much for meeting with them and providing that feedback today. Dr. Hucker, is there any more for the board chats of it?
Grab that microphone just to make sure everybody. There's one additional statement that I just need to make sure that the board is aware of, and that is, Last year, Idaho did pass an immunity statute, and that immunity specifically states that a person is immune from civil liability for damages or an injury resulting from exposure of an individual to coronavirus. That is 6-3403. It further goes on to state, and this is obviously up for question here, that says immunity as described in this section shall not apply to acts or omissions that constitute an intentional tort or willful or reckless misconduct. It's just important for the board to know, as our current draft states on our website, our reopening plan does not have any mitigation strategies or any next steps. So it's potential, and I just feel as the superintendent of the district, I just need to share out the risk associated with that. You could be, should something happen, the door could be open for potential, litigation because we perhaps did not have a strategy. So I think what tonight's workshop, what we would like to just be able to answer questions. We have the whole cabinet or most of the cabinet here to be able to address some questions. Right now, as you know, in your June board meeting, everything that you had kind of put into place last year for the school district, COVID-related, was rescinded. So that's, and I think that was a very supported decision based on what you know at the time. As I have said now, and as your new superintendent, I think it's just important that we are listening to the surroundings and what's happening day by day. In fact, just today, you heard some different recommendations from the state than what we heard a couple of days ago if we were to have that conversation with folks in the community. So I think the big question that we need to grapple with is this. The way I kind of view it, we have a couple options. One option is to just remain with the work that we've already done. We have a reopening plan online. It does not require us to wear masks or anybody to wear masks. It doesn't require us to contact trace, of course. It doesn't require, you know what it doesn't require. I don't need to restate all of that. And then be reactive. Be able to, keep our fingers crossed and hope that we're okay and we don't have to close schools down or go to some other avenue of hybrid or something along those lines. That's clearly an option. I think we've learned tonight as well even from the medical experts, in fact, that we are exactly a school district that is representative of our community. I have to say that in my 45 days here, again, I have been very purposeful and visited many businesses and entities, and each of them are struggling in their own ways. I don't think I've honestly gone to a retail establishment that has not got a help wanted sign hanging in their store. So you can imagine the challenges that this could place on our community as a whole, if indeed the current employees that they do have had to perhaps stay home and take care of their kids for a couple of weeks or something in the event of an exposure or an event the kids get sick themselves, it could really place a big strain on our business. Our businesses. We are exactly the same. The school district still, I'd like to tell you today that we're 100% staffed and ready to rock and roll for school in 3 weeks. We're not. We still have vacancies that we're busily trying to fill, and our goal is to obviously have those in place. But I think it's just evidence that we represent exactly our community as a whole. And so what can we do that the community can get behind so that we can keep our kids in school and not create that crazy flux? It's you all know as parents, it's difficult if you're home 1 week and not home 1 week, whether it's from work or whatever the case is. That's a challenge, and I think we need to come up with some avenues. I think for me, probably the big eye-openers for me has been the last couple of weeks. As a new superintendent, I'm really just listening and learning and trying to see how things were handled last year and what could we do to learn from that and make this next year even better. And it's become evident that this darn Delta virus is a little different, and just like we didn't know last year, we don't know what we don't know. We don't know much about that either, other than this. It's the other countries that have been ahead of this in the timeline with us correct me if I'm wrong, but it appears that there's a pretty drastic steep initial curve, and then it's a pretty drastic drop off. I would love nothing more than to survive that. Get through that, get it dropped off, and go. So the big question is, what do we do to do that? And that's the tough questions. As I said before, as your superintendent, I think it's obviously my focus is education. That's what I have a doctorate degree in. I do not pretend to be an attorney, and I do not pretend to be a medical doctor. I leave that up to others to hopefully provide us with the information that we need. Heck, I can't even fix my car nowadays because they're so techy. I need people that know how to work on cars to help do that. So I'm never going to pretend to be somebody that I'm not or know something that I don't know. What I do know is that in my 45 days, the community has spoken and said they really would like to make sure their kids can stay in school. That is really important. And yes, just as you're seeing around the community and right here in this room today, you have both sides of the conversation as to what will work and what won't work for them. Our difficult task is to try to figure that out and find hopefully some middle ground, if middle ground exists, or find some help along the way. I know I don't want to wear a mask. I don't like wearing masks any more than the next guy, but I also know this. I also certainly don't want to spread anything to anybody that I don't know about. And so if the experts tell me that that's okay, that I would be better off to do that, I'm willing to do that during the work day and keep our kids safe and our teachers safe. I'm willing to do what it takes because I want to keep things open. So I just would ask that as we spend maybe the next 10 minutes or so, I want to make sure that we can answer your questions. As I already said tonight, we're not voting on anything and deciding anything tonight. Just want to give you the questions or the answers to your questions so that then we can follow this up here shortly with another conversation at some point down the road here. It can't be too long because everybody's wanting to know what's going to happen as school starts. And we need a plan. I just need a plan in place. I want to know if we're going to be reactive. We can try to plan accordingly. We can truly do that. But that could mean not only is it teachers that we're talking about here. We have limited bus drivers. We have limited custodians and cooks, as you know. Anytime we have a significant absence in that pool, it really puts a strain on schools. We have some data from last year as well, and that's posted kind of in our we've got some working documents too as well that I think you've all seen that kind of can show last year around, I want to say 8% or so. Is that right? I think around 8% or so, once we hit an absentee rate of around 8 to 10% in our buildings, it becomes really stressful on that building. Now, depending upon where that 8 to 10% falls, sometimes the schools have been able to remain open and sometimes they haven't. And that was the influx last year that you all experienced. Some schools needing to close for a while, some not, creating all of these challenges. So I'm hopeful that we can come up with some ideas tonight that we can further explore and see if we can't put some details behind to help us come up with something that will work for as many people as possible. Thank you.
I've got a couple questions. One, Mr. Voller, I got one for you. On filters, last year we did a lot of work around filters and particularly in portables and some of our poor air spaces. We put some air scrubbers or something in there. Have we continued with those filters, or is that in the budget for this year? If you just want to give an answer, I can repeat it for you if you want.
We have over 13s that have been on back order for 9 months, and there's limited supplies across the U.S., so that is a shortage. But normally we would use a MERV 8, so we're still upping the incentives for that. And we put in ionizers that you were referencing in as many places as applicable. So I think we put in over 45 different ionizers and units across the district, so those are all still. The red light's on.
I don't hear it through the speakers.
You want?
Yeah.
The short answer is yes. We do still have those mitigation strategies in place. We've opened up the dampers so that we're increasing airflow into buildings. We've increased filtration as much as we possibly can, and we put in ionizers into systems that are working in the system. So we put in over 45 different ionizer units throughout the district.
Can you just speak what we're doing for our portable classrooms? I think last year we had individual filtration systems. Are we still planning on doing that again this year?
Yeah, and those classrooms got ionizers. That's specifically the ionizers in those.
Dr. Hucker, you've mentioned a couple times no decisions being made tonight, but I think in a lot of the emails we received over the past 48 hours, certainly there are people who are going to make different education choices depending on the decisions that we make, whether that's people who don't think we're doing enough or people who feel we're doing too much. And so what options are available for those folks? Because we don't have our online school for this year. So could you speak to that briefly? And then if we aren't making decisions tonight or pointing in a direction, when do you anticipate we would do that?
Okay, great question. Thank you for that question. Yes, it's accurate to say that District 271 postponed their magnet school opening, your magnet school opening for one whole year, and along with that, the e-school as was organized this last year was also canceled. However, in light of the recent events and the information that we have, the district has been working very diligently to create a contract and partner with the Idaho Digital Learning Alliance, a state-sponsored online school option, so that we can provide that option. We will see how many students will take us up on that offer, how many want to be able to take their classes and remain in courses full-time online. If that number is fairly large, and I don't know what that number should even be, so I'm not going to guess tonight. But if that number is fairly large, then our hope would be that we could bring that back and self-perform that function by second semester. And if that number remains relatively low or workable, I guess, for us to continue for the full calendar year through Idaho Digital Learning Alliance, we would do that. And then our plan is by next year, again, unless we get none, or I'll say 10 or 20 or 30 kids, if that's all that we have an interest in online, I guess that could change the direction that we would recommend we go. But we anticipate that there's hundreds of students that would like to be able to have that option, parents as well. And so our intent would be that we make that a permanent option. So we will staff accordingly, and in another year, or perhaps even halfway through this year, as I said, we will have that online option that we will self-perform, which I want to give Idaho Digital Learning Alliance the credit that they deserve. They've done great helping Idaho schools this last year. I just also believe that District 271 can do that job maybe a little better as well personally, and we would like to be able to kind of control that content a little better, and so we want to be able to self-perform that as long as we have the students. So to follow up also on your question as to when do we need to make this call? I believe obviously sooner the better. I think, as you said, that's on everybody's mind. What are the plans? What are we going to do? I think an option that could be created following some of the similar but use different matrices as you did last year when you started school. Create some avenues that will be some signals to help us. If the board's choice is to not require masks and not do contact tracing or any other mitigation strategies, we would need to know that obviously sooner than late, sooner preferred as well. If the board's choice is we would like to try to start the year with no masks, but we need to be able to keep kids in school and keep schools functioning. So at some juncture, certain percent of the building is out sick, or certain percents of the hospital. I think that's probably one of my big concerns is obviously the hospital capacity. I think that's just a real easy number for us to to watch. And as we heard, the Idaho as a whole numbers are always lagging a little bit. So I watch them, obviously, but I think what's more important is our local numbers. I may at some juncture have a heart attack, and I want to be able to be taken care of just like everybody else in this room would want to be able to be taken care of. And I don't want to have to be flown on a life flight out of state somewhere for hours and hours, because I know that time is critical. So I really want to be mindful of the fact that our hospitals are what they are. They're as big as they are, and they have the services that they have. And I think we need to be mindful of that need as well. So those are the questions, those are the talking points that we have. And again, tonight we're not making a hard decision, but yes, I would encourage the board. We're going to talk a little later on one of the other options, one of the other calendar items is to schedule a kind of an open house and listen to the community. I think it's also very important that we find another time where the board will make a motion and make a formal decision whether we want to stay with what's already in the plan or whether we want to have some phases along that plan that would help our schools stay open and hopefully ride out that wave. There are some schools in Idaho that have started that they may require some, maybe mass or some other mitigation strategies, and they're doing it for a very brief, specific amount of time. And they're going to wait and see, where things are. As we all are hoping, we hope this thing spikes fast and comes down. A week ago, I was told that really our spike in Idaho was estimated to occur in mid-October. And now that's moved up a couple of weeks, maybe 3 weeks even, in our area. So I think it's as much encouraging as it is disappointing, I guess I would say, but it would be nice to be on that back hill side of that incline once we get there. So how can we keep our schools open and keep some consistency for our parents for hopefully, through October. So we're talking, 5 weeks, 6 weeks of school. Any other questions that I can answer real quick? Yes.
Kind of correct me. It was in the packet. There was a document labeled Plan 2, and so it's titled Coeur d'Alene School District 271 School Year Draft Reopening Plan. The board approved a draft opening plan. Is this the newest recommendation coming from the administration, or is this something completely different?
Yes, I hear it's on.
Test. Oh, yes, this definitely works now. Okay, yes. So draft 1 is what was approved, and that's what's posted. So you're absolutely right. Draft 2 is a continuation. We want to make sure we're sharing out with the board current CDC guidelines and some sample items of some mitigation strategies to try to keep our numbers at bay so our hospitals can handle me having a heart attack if that were the case. So all of that in draft 2. Is there as it's just a working document. It's not being presented to the board for approval. Those are items to just be discussed. And then, but ultimately, everybody wants to know what will be our plan. And so we will have a formal plan at some juncture that needs to be presented and voted upon in a formal mechanism so that, again, everybody in the community knows what we're recommending, what we're going to plan to do.
Yeah, and I think it's important to remember that when the board took action in June, our numbers were very different. Tonight, we were able to see some of those numbers. We had a positivity rate in our community of approximately 3% in June when the board took action to not require masks for next year. And I think there was hope amongst all 5 board members that the situation will look very different today than it actually does. To hear we're at a 24% positivity rate, I was surprised, to be honest. I didn't expect your presentation to be as powerful as it was, so thank you for all that information. I was under the impression that we were going to get an updated recommendation from admin on how to safely reopen schools. We have never really talked about the immunity statute, and I'm more curious to hear some legal weigh in on that. I think our plan must meet minimum safety procedures, and if we're not, then I would like to highlight where we're not doing that and at what extent. I don't know if Megan is going to be available for that session or if she can reach out individually, but to talk about that, I was surprised to hear that. And I'd be curious if this new draft plan meets the basic requirement that we're providing safe learning spaces for our kids. I guess those are my questions. And I had a few details on this, Nicole, specifically on the last page. There's some metrics that are cited, and it wasn't clear exactly what they were referring to. It's on the very back page, the decision critical piece. And it talks about cases and numbers. So if we could just clarify those, it was hard to know. It says greater than 150 and/or daily seven-day moving average incidence rate in Cooney County greater than 60. So is that per 100,000? Is that per week? I know every organization uses different numbers, so it's confusing.
I apologize for not having that in front of me, but from what I can remember, there's three factors there that we had indicated as might be moving us to those content areas. I would say those topics were what we were using to make decisions last year. And those numbers that are at the bottom of that document would be something that we could look back on our data and say, those are hard lines from this point forward. We had resource problems. And so we might look at those categories and those numbers and expect that if we are in that situation in any one of those areas in our community, that we will have problems opening buildings for substitutes, like short on substitute teachers, our kitchen staff, our custodial staff, and we'll have a lot of students out sick as well.
Yeah, if you could provide those metrics for us so we could see those, and it's hard to remember back to the data that we have seen over the last 18 months, but for me, those metrics would be increasing or important for our next decision. In addition to that, I read through the board packet and there's a lot of documentation in there. All the documentation seems to me is summarizing the same recommendation. Have you found any other recommendations for this board on how to open schools safely that we can use in our decision-making process?
The simplest recommendation that I can give is for you to hear from your superintendent that I can't pretend to be who I'm not, and I'm not a doctor, and I am a doctor in education, but not a medical doctor, and I'm not an attorney. We did visit with our school district attorney today. I wanted some guidance on this as well, and I would say this is such a divisive conversation on both sides, and you all know that. It's nothing new. It is difficult for me to make a recommendation to the board that may be in disagreement with legal counsel and or with, in this case, the medical professionals. I want to keep us out of lawsuits. I want to keep our kids in schools and keep us open. In my professional opinion, it is, we open the door. If we choose to do nothing and then react, I don't want to be, let me back up. I gotta share one little story if you'll humor me for a second. All of our schools in the district today have some incredible security features all over the school. And those are there for a reason. It's for a hopefully never happen issue that maybe has happened in some other district. And so we have taken a precaution, even though we hope that nothing else will ever come from that. And I believe that if we chose to do nothing at some juncture, if indeed something horrific were to ever happen, and we didn't take some strategies to try to help that from happening, it's difficult to stand in the courts and say that we did everything we could when we perhaps didn't. And I use that analogy in this case. I believe that we need to find some mitigation strategy, some middle ground here that will keep our schools open. I think there's lots of options there. I think we're all hopeful that we don't have to start with masks. We don't have to start with podding and start in hybrid. But again, in the last 2 weeks since I've been here, I've heard a whole lot from various health officials. We can choose to believe them or not. But the statewide data from other experts, not me, is pointing to the fact that come mid-September, end of September, early October, we're going to have a whole lot of cases. So yes, we are happy to hear from the experts that the vast majority of our kids and hopefully at least our staff have had an opportunity to be vaccinated if they so choose. That gives me some comfort. I'm comfortable relatively with that. What the challenge is, I think, is if our hospital is already by Friday this week expecting numbers that we didn't see here in Coeur d'Alene all of last year, that's shocking. Of course, I wasn't here in your community last year, but that's troublesome if your hospital is at already over capacity and it's still 3 weeks before school starts. I think that unknown is what I want to try to be prepared for. And so just like preparing our schools for that hopeful never incident that happens from something bad happening in the school, so we try to really protect and create some safety procedures. I think our community wants to just make sure that their kids are safe, and that's what's created lots of conversations on both sides of the fence, and that's the challenge facing all of us at the district office, every one of your employees. We live and work this every day. That's what you hire us to do. You as a board, I certainly am very sympathetic to you. You don't get paid. You don't get an ounce of salary out of this, and honestly, why you volunteer to do this is sometimes makes me wonder myself. But I give you thanks, and I know that your hearts are in the right place and that you want to make the best decisions that you can for our kids. So that's a long answer to a short question of simply saying, I don't believe that we should do nothing and then just react to whatever might be, because I think that reaction could be the fact that by then we have to close down a school or a whole district and have kids go online for a few weeks full time, and that'll be extremely detrimental to our community as a whole. I think we've got to come up with some sort of plan that will phase us before we directly get to that, if we end up having to get to that avenue. And let's all hope that we don't have to get to that avenue. So how's that for a kind of a easy, long-winded question, or answer to a question?
Okay, well, I think one of Trustee Morishaw's questions was when, and I'm going to weigh in on that because I feel that we owe the people here and the people watching some idea of what this board is thinking. And so I would like to use that as an opener for opening the floor for trustees to comment on where what their thoughts are on this plan 2 and input they'd like to give Dr. Hawker moving forward. I'm happy to start unless anybody else wants to. So the first part says mitigation strategies, and it talks about masks are not required at any Coeur d'Alene School District facility. That's consistent with Plan 1. My preference would be that we would indicate masks are recommended, but masks are not required, so that it's clear we do recommend the usage of masks, but that they are not mandated and they are not required. I then see for high to extreme impact level, and then there's different provisions that are going in there. I struggle with saying to this community that we're going to recommend masks, but they are not going to be mandated. And then we would turn around and have a provision that our current status of this community would indicate we're going to go straight to mandating masks. So I struggle with this mitigation strategy for high to extreme impact, because we're right there now, which means we would open schools with masks being required under this plan. And I don't agree with that right now at this stage. I also would look at, it talks about school transportation. It says CDC's order applies to all public transportation, including school buses. I believe what you sent today, Ms. Pekarsky, actually exempts school buses. And so I would want this to be consistent with that. I don't think it's required on school buses. And so not having that requirement on school buses, I don't think that masks should be mandated. And then I agree with the majority of these larger pieces that with our contact tracing, which Ms. Pekarsky's already commented on, that we don't have the ability to, even if we wanted to. But I do think it needs to be clear that positive cases for COVID would not be going to school. I think we've all made it very clear that if you are positive for COVID, you will not be allowed to attend school. I think that's consistent with our mandates under our current statutes. And I also would agree to emailing family, to email the families if we know of a positive case within a child's class. I don't think that's difficult. That's not contact tracing. That's just letting your 5th grade teacher's class know there was an exposure, so that those parents and family can be aware of that. I think I think that's something we should do. I don't know if everybody agrees with that. And the last piece on here where we have kind of outlined what those triggers would be, I'm not comfortable with the triggers personally. I'm one person, but I struggle with what happened last year at the end of the school year. I feel like, again, if we as a board are going to vote to not have masks be mandated, but we're going to turn around and put numbers in place that would say, okay, right now we all have to be in masks. I just don't think that's genuine. And so I don't know the answer. I feel like looking to the community's level of transmission and the positivity rates and the hospitalization is really not where I want to be looking. I heard resource problems, substitute teachers, kitchens, kids out of class. I think that is what I would like to be looking on an individual building when we're talking about what mitigation strategies need to be implemented and what does that look like if we have 10% of our staff out of a building due to COVID. Is that really serious? Is that not really serious? And I don't have those answers, but that would be where I would be leaning in terms of those metrics that we would be looking at. And we talk there's a lot of commentary about follow the science. And I would just say that, in my opinion, the science is not consistent for every research and every study that I appreciate you guys, and I don't want to make this isn't about trying to polarize this issue. I just know that for it's no different than what I do many times in my own career. For every point, there can be a counterpoint that is reasonable and valid. And I'm not trying to take away from anybody's perspective. I'm not trying to take away from the fact that this is serious, and the people who are recommending mandating masking love children and are genuine about their desire. I just don't feel that with as controversial as the science is, in my opinion, and with the fact that there is no agency that is mandating masks that is going to tell this board to mandate masks, then it is not my job to mandate masks. I don't feel as a school board member that I get to tell parents that they have to mask their children with what I know about the current circumstances and what's happening. And I did my research. I do this based on kids. We're talking about under the American Academy of Pediatrics, you had hospitalizations of 0.1 to 1.9 of kids and 0.00 to 0.03 deaths for kids. You have a flu that killed 358 kids in 2009. And we did not mask, and we did not do anything. And then again, we have through COVID, ironically, through July of 2021, we had the exact same number of COVID deaths for kids. And we have just such different ideas about how to mitigate these. And lastly, I would say, and most importantly for where I fall on masking, is I genuinely believe that there are risks emotionally and mentally and physically for kids. I believe that. I see that. And so what I am trying to do is balance. I am trying to balance what needs to be a protective measure versus, and the risks associated with COVID for our kids versus the risks of masking of our kids. And so that's where my decision is laying today and what my thoughts are. I will let someone else take the floor.
I'm happy to be the altar voice, I suspect. But, for me, we've gotten a lot of feedback from people in the room and lots of frustration. And I can honestly say that this is not an emotional decision. I'm not scared of COVID-19. I've been vaccinated, but I still wear a mask because I wouldn't want to infect anybody in this room if I wasn't currently had COVID. But for me, it really comes down to the one commonality that I've heard in the hundreds of emails that we've received. Some have been polite, some haven't been so polite, but the one unifying factor that I have heard is that we all want kids back in school this year. I heard it from Dr. Hawker, I heard it from Dr. Hahn at the state level, we've heard it from the American Academy of Pediatrics. I want to read their opening statement on their brief that they submitted. The AAP strongly advocates that all policy considerations for school plans should start with the goal of keeping students safe and physically present in school. And I can say here today, more resolute than ever, that our best chance at doing that is if we have some basic mitigation strategies. Nicole Piekarski was great in tracking our data, and we know what the likelihood is that we'll succeed if we open schools without any mitigation strategies. And masking, universal masking, is our number one strategy, unfortunately. It's the best tool that we have. And we've been successful at that. And Nicole Piekarski shared some of the data that when we saw high community disease activity, that we were still able to keep our schools open. And so for me, it comes back down to that. I want our kids in school. And if we can wear a mask for 1 month and get over that hump, like Dr. Hawker shared, I am willing to make that sacrifice for our students. And I think it's important to listen to the science. Wait a second. I think we all deserve respect, and I would ask that you provide the same respect for my comments, Chair Brumley. We all have opinions and beliefs about this, and it's not a personal decision. It's about doing what's right to keep our schools open. And it's going to come down to an operational predicament for us. Dr. Hawker shared that we don't have enough substitute teachers. We don't have enough bus drivers. And if our staff get sick, then we simply cannot keep schools open. So we can take our personal political beliefs out of it, and we can focus on keeping our kids in the classroom. We can focus on bus drivers picking our students up. And if we don't, then we're going to have to pivot, and we're going to have to move to a hybrid. We're going to have to backtrack and ask our kids to wear masks. And that is going to be a lot more difficult than opening up schools with the hope that we can be successful. And the very most important thing for our mental health for our students is being in school with their peers, not pivoting back to a hybrid, not asking our teachers again on the fly to provide remote learning. That is not where their heart is this year. And if we can get through September, maybe the end of September, beginning of October, maybe our students will have more of a normal year. Maybe we'll have the ability to remediate learning loss that our kids experienced last year. But if we have no plan going into this and we're just going all out that we're hoping it will work out, the odds are not in our favor. And we heard that over and over again tonight. Every document that was in our packet supported universal masking. Not for the end all, for the entire year, for a short period until we can get our community through this hump. When we approved that plan in June, it was never with the intent that this would be the plan when school opened. It was always with the understanding that we would use the most available data to make a decision. And I feel as though this board made a decision in June, and we haven't looked back, and we haven't taken into account some of the dire statistics that we heard tonight. And that could be dangerous for our students, staff, and for our community at large. So I guess I would just ask that we take our politics out of it and we make a decision that can keep our schools open, keep our students safe, and keep our community safe.
Okay, thank you. I'm going to be brief. I think for the most part, my sentiment follows Ms. Brumley's on this. I think it's important that schools be opened. I think, what went on last year, particularly at the end of the year with the changes and the week to week, it was just too unpredictable. It was too hard on our families, I think our staff and our community. And that's what concerns me with Plan 2 here is the potential to fall into that trap again where we're jumping around week to week, building to building. And that's my biggest concern here. When it comes to masking, I guess at this point for me, with the availability of vaccines and the choice for people to get vaccinated, at least those 12 and older, that it's personal choice. And I believe that lies with the parents and the individual, the employee, whether they choose to be vaccinated or choose to wear a mask. And that's where I'm at with masking. I struggle. We did things last year that were against recommendations of CDC, of Department of Ed, of the State Department, whoever it was. I think we had to make the best decisions that we could based on our situation here locally, and that's still where I'm at. I struggle, we don't have to look very far for districts that operated differently than we did last year, and much more consistently, with what appears to be the same level of success or infection rates. And so I struggle with that, that we could say, okay, we have to have masking when, Lakeland ran without masking all year and they did not close a building all year. So that's where I'm at, would be to stick with the plan that we approved, realizing there may be a point that that just doesn't work. Maybe we do run out of people, and I understand what you're saying. If we don't have enough people to operate a building safely, what are we going to do? And we don't have that on paper right now. So I'd look more at that, I guess, to iron out those details.
And I can be even more brief, thanks to Jen and Casey, but I also am comfortable with Plan 1. My only concern would be the same, that we have something in place for staffing concerns. We run out of bus drivers, that our community is well aware that those things, we may face those things as we're going forward with masks recommended, and that they give grace for whatever that means for others, but sometimes we just won't have the staff in buildings, and we may have to shut down a building, and nobody wants to shut down any buildings. It's important that we get back to educating kids. I feel like when I got on the board, it was because of my passion for educating kids and providing the best that we can provide for people, for children in Coeur d'Alene School District, so that they come back to our community. And this past year and a half, it's been, meeting after meeting after meeting about, not a lot about educating kids, sadly, about what are we going to do now, and what if this, and what if that. And quite frankly, yes, I've missed the last 2 board meetings. I've been out of town, and it was a breath of fresh air for me mentally and for my soul, because this has been, it weighs on all of us. And you guys probably, I don't know if you believe it or you don't believe it, but we live it every single day. We all have kids that are in the school district and have been participating successfully, and I'm very proud of that. We've had districts on the border of us who didn't have school last year, who didn't have extracurricular activities. We did have those. Yes, we had a lot of bumps because this is all new, right? Nobody knows what we know, and we definitely, my degree is in education. It is not in COVID or flu or anything for that matter, but what I do know is we need to get back to educating kids and having kids in the classroom, because that is most important. It is a safe place for many of our students. School buildings are. I can go on and on about that, but I do believe that if there is a positive in the class, I do believe that an email should be sent out to the parents of that class. I don't know what the strategies look like if we face, and we probably will face, a staffing issue or something, but the picking and choosing last year, it kind of was like B7, PE weights has to mask now. And, people were doing the best of what they were doing to try to keep kids in place. But my reason for Plan 1 and not for these other mitigation strategies is because it was too much. And teachers to know, like, hey, are you in B7 weights, or are you a freshman? Or, we need teachers just to be teachers, because that's what they love and that's what they're passionate about. So for me, that's where I am. And this is serious. I do take COVID-19 serious. It is serious. I've seen it. I've had people who have experienced it. This isn't me not believing that it's serious. This is just me believing that kids need to be in school and be educated. That needs to be what we're focused on. We have amazing people in our buildings who would probably love to just get back to doing what they love, not so-and-so sat by so-and-so and we got to get this to that. And all of that was very important. And we had a lot of people doing that and spending so much time doing that they're probably going to be happy to get back to, doing what they love. But I guess I wasn't very brief. So maybe it's me missing 2 board meetings. But I do appreciate the emails that we get. People probably don't even realize for every please don't mask our kids, we get a please mask our kids. I mean, it is literally every other one that comes in. So it is, we value everyone's opinion, and I see both sides, but I see both sides can work together. If my kids feel strongly about wearing a mask to school, they'll wear a mask to school. If not, they won't. And I don't see that. People have talked about the bullying. I haven't seen that in our schools. I'm not in our schools every day. I do try to ask my kids, hey, do you see this, if we get an email or not? But I believe our kids are kind. And if they're, I don't know, I just don't see, and maybe that has happened. And I'm not in every single school, but please, if that is the case and someone is not feeling comfortable because that's happening, go to the teacher and give them the opportunity to figure it out and have those discussions, so that we can all work together through this, because it's not going to go away. It's just, I don't see it going away. It's not like the flu, but it's going to be like the flu in the sense that it's here. So anyways, appreciate everyone for coming out and for everyone's time that they've spent. The professionals, the Dr. Han that was on tonight, and our nurse, and there's just been a lot of time and thought that goes into these decisions, believe it or not. So I just want to thank you, and that's kind of where I'm sitting right now, and hopefully from here on out. So I guess we'll pass it to Rebecca.
I guess for my question would be for the board, is there not more of a middle ground somewhere? Especially as I think about, especially the parents in our district who work for Kootenai Health, who are writing us and saying, please do more to be safe for our kids, and we hear from those that work in our community, the doctors, the nurses that are working in our community, who are saying right now, would you do more to provide safety for our kids? These are people we know, we trust, the same doctors that we will go to for everything else in our lives. And so those doctors are saying right now, would you do more? So I'm curious if there's not more middle ground somewhere, because I feel like doing nothing with Plan 1 is we're going to end up being reactive. And I think that's last spring, once we removed masks, that period from April to the very end, it was messy, with one school doing one thing and one school doing another. And so, I guess I would just put that question back. Is there more that we can do? Have we asked teachers how they feel? Because I think there's a number of teachers in our schools who would say, could you do more for school safety? Can you do more for my classroom safety? Because I want them to go back to teaching and only focusing on that. But I think there's going to be other mental issues just from coming in and worrying about that. And yeah, we can say they can be vaccinated and they can do whatever, but everybody's situation's a little bit different. So, Nicole, I have one question. Within this plan here, were those metrics that you gave us here, were those based on last year's data that you tracked, or was it?
Yes.
So that's from our experience that we lived, that we experienced. That's kind of what we followed. Okay. It's interesting to me that a lot of the feedback we got today was from the state of Idaho. It was the Idaho Back to School Task Force. It's the Idaho Department of Health and Welfare. It's Panhandle, the Idaho School Nurses Association, and so really experts in Idaho who are presenting other things than maybe what we're choosing to do. And so that would be, I guess, my last statement on that.
Sorry, Rebecca. Well, I would respond to your middle ground, and what I would say is the recommendation is for masking. It's not to mandate masking. The CDC recommends it, the AAP recommends it, and the Idaho Department of Health and Welfare recommends it. And for every doctor, I can tell you there's a similar doctor saying don't mask. For every nurse, there is a nurse saying don't mask. We saw that in our own emails and in our own community. I know that exists. In my own family, the diversity of doctors and their opinions exists. I guarantee you that you poll our teachers and it will be just like this community. You are going to have a division down the middle. And so I don't know how we got to masks being recommended, which is what I'm advocating we do, to we have to mandate masks. Okay, well, I'm going to hand this around if anybody else wants to respond to Rebecca, but the middle ground to me is we are following the recommendations, but nobody is mandating masks, but that's what we're being asked to do. And I don't know that we, and I am not at a place that I think that is what's best for kids.
I think we're mincing words, Chair Brumley, and I just think it's important for the audience that we understand your comments. The recommendation is for a universal masking policy. So you are correct in that those organizations and those entities do not have the power to mandate masks in our school district. But the recommendations and all of the supporting documents that we received today is for a universal masking policy. That is their recommendation. So we're mincing words when we're saying they're not recommending that we mask students. They absolutely are, but they're recommending a universal masking policy. And I'm happy to read it from the American Academy of Pediatrics if you would like me to into record, because I think that's an important piece that we need to all acknowledge in this room today.
Rebecca, I appreciate your comments. I don't know what the middle ground is on masking, if there is a middle ground. And maybe there is some tipping point where, okay, if buildings have to close, then I think most people would say, well, then mask, right? But what is that point? I don't know that I can get there. I think for me, I think the governor's taken this approach when it comes to masking. That is personal choice. It is a personal responsibility, and that's where I'm at with it. I think it's the right thing to do. I've been vaccinated. My family who is eligible has been vaccinated, and my kids will probably wear masks to school on the first day, at least mine kids who are not vaccinated. But that's our choice. And I think that's, at this point, to me, that's appropriate based on the availability of vaccines and the risk to children and the damage, or just everything we saw last year on kids. It was hard to go in and out and up and down and 2 days a week and 3 days a week and 4 and 5. And so that's where I'm approaching this. I think Ms. Pickford talked to that, or maybe it was Ms. Brumley, about looking at it from the viewpoint of our students. And that's where I'm at. And I understand that may create risk for people outside of school, additional risk. And I guess that's a personal choice as well, right? That they're going to have to take additional precautions, I guess, is the way I see it.
The only other feedback maybe that I would give for Dr. Hawker is maybe there's a way to help schools or parents know that we're getting close to making a change so that people have time to plan if that's necessary. And maybe it won't be, but especially, how much lead time parents need to know that, hey, we're headed in this direction. Here's where our school's going. And you know what? Pretty soon we're going to have to go remote. We're going to have to do X, Y, and Z, whatever that might be. I know in my family, as a working parent, I need lead time on that, to figure out childcare, to figure out all those pieces. And so as much lead time for families, that's what we're going to need.
Okay. Dr. Hawker, I would give you the last word. Do you have anything you wanted to say in light of those comments?
Recognizing that the time is short and we still have a couple other items to talk about, I'll just simply say thank you. I think the workshop's been very good, and that's what we needed. We will be able to we'll be able to put together hopefully some answers in regards to what do those hard times, really what do those numbers look like? What do they need to be? I'll try to convene that quickly for you, and then we'll get you that information, and then we'll decide whether there's any next steps that are needed. Based on additional conversations, seems like the majority of the board, 3-2, are okay with the current plan that's in place. So that can help us make those next steps. Again, our challenge, of course, my challenge is what we've already talked about. We just want to make sure that we have our staff and our in place so that we can keep this as keep full-time schooling as an opportunity for our kids. So we'll get together and we'll get you some additional information, and we'll let you guys decide whether we need to do anything more or whatever. I would say too, we need to, because no action item comes out of tonight, I think it's still important for us to either summarize that we are staying with what we currently have in place as we start the school year, and make that public information official as soon as possible. So we'll work towards that. The last couple items, is it okay if we move on to the next couple of items? Real quick, they're just primarily updates. The next item has to do with the conversations that have been floating around in regards to the equity framework that's there. And we just, after the last board meeting, we're organizing kind of a group, and I just wanted to kind of share with you what our plans are with that so we can get you the information. The timing of everything, of course, and COVID seems to have just always hit everybody at the most inopportune time. So in the equity framework as currently written, there was always, if you look back at the back end of that framework, there was always plans and intents to continue conversations, continue to get feedback and input. I think that's important in this case because what happened is then COVID hit and kind of lots of things shut down, and meetings like this became more challenging and went online and this and that. And so those conversations have been maybe not as robust over the last year as could be. So what we're proposing that we do is that we create, we're going to open it up for a while, perhaps 3 weeks or so, and ask for volunteers that perhaps want to be part of this work. We really want to make this a cross-representative group. I think it's important you've welcomed a student advisory group to help the board with some decisions, and obviously we're all here for students, so I think it's important to have some student voice on that. I think it's certainly important to have every grade level, elementary, middle school, high school grade bands at least, have parent reps, staff reps on there. I think counselors are important as well, and then we need to make sure there's geographic representation as well. I think what we'll find, what I hope to do is we will advertise and have an online I'm interested kind of a button, try to see who's out there that would be willing to help us do this work. And the goal is to try to create, a dozen, maybe a dozen and a half, somewhere in that range of a committee that could do this. So some folks could wear multiple hats. Maybe somebody's a parent and also a staff member. That could be 2 items at once. But ultimately try to keep that committee. I think there's a lot of interest, and maybe we could have 50 people apply. But I also know that, having 50 people in a work group, it's rare to keep all 50 attending all meetings for any length of time. So we'd rather have that grouping be just a little small. We will also, so our plan is to do that most of September. So we will, right when we get back to school, we'll start promoting that. I think usually a lot of folks are interested in trying to get involved in some school ideas. And then we'll bring that group together as early as the end of September, maybe 1st of October, and we'll have our first meeting. And then we'll go from there. And we'll see kind of how that meeting goes. I think it's a great opportunity for us to kind of go through the whole equity framework again as well, and make sure definitions and understandings, there's been a lot of conversations about all kinds of different things in the community, and I think this is a good opportunity for us to bring the community in and be part of solving some of those questions. So looking forward to doing that and looking forward to bringing you a report after they've had a meeting or two. Those things do take time, and I just want you to be aware of that as well. We want to do a due diligence search and let people apply, so I really feel like we need to keep that open for 2 to 3 weeks at least. So that puts us really at the end of September before we'll be able to go through and then start crossing names off that, or selecting names in, I should say, of people that can meet at least one of the kind of the categories. So that's the plan for that. Any questions that the board may have in regards to kind of next steps for that equity framework evaluation? And this will all be led, I'll be involved as much as I can, but it'll be primarily led by Kate Keinert. Yeah, I'm hopeful. Let's get all the back to school information out over the next couple of weeks and let everybody worry about getting kids back in school and all those plans. And then sometime in that, we'll do a district-wide announcement saying we're asking for some volunteers if people are interested. I know I've already had a couple of folks after a few meetings that we've had that have expressed some potential interest. So hopefully they'll throw their name in the box, and we'll be able to get that group put together early. Okay, and the last item then on the agenda is let me grab my agenda here. As we discussed in our last board meeting, there's a recommendation that we are modifying a policy, and that policy will come before you at your next board meeting in September? Your September board meeting, that will hopefully try to streamline your board meetings. And so we're asking for community input in those board meetings to be focused on things that are on that agenda item. But I believe in order to be fair and transparent and still provide an opportunity for voice with our community, we need to be strategic in creating opportunities for the community to talk to us. And hopefully, even some of them, if all board members are going to be there, we'll have to announce it as a formal board meeting. If only a couple board members can make it, we can have that meeting. We'll try to encourage as many cabinet members that can attend to be there to help directly answer questions, because as I stated in the last board meeting, what's really the challenge is that you're only allowed to have one-way conversations during your board meetings, and that's not a conversation. That's not helping communicate. So we want to communicate. That needs to be a two-way conversation. So I think it's really important for us to call them listening tours or whatever you want. Have that with your community. So tonight's item would simply be an ask if we could maybe try to find a date. Once we find a date that might work, my suggestion is try to make it, an hour. Try not to go too terribly long, but make it so that community can come, and we'll do that throughout the school year to create those avenues for the community. So my hope would be that we could have one in the next 6 weeks or so. If that works in your schedules, I'll try to find a place. It could be here, but we may also want to, this is a listening opportunity, so I kind of feel like here it's a little too formal at times. I don't know. I guess I'm still looking around, but maybe we can find a park one night and we can just go to a park. We need sound and make sure everybody can hear, right? Maybe there's other places, some of the schools and things. Maybe we can just find some locations to allow some community members to come and in a very informal way be able to ask you questions and us questions. Be able to, we don't expect you as trustees to know the answers to every question. Hopefully we can all have those conversations and help and help create a little more unity in the community. So with that said, do you have any time available in the next month or month and a half, 6 weeks or so? I know things are really busy the next couple of weeks, so that's why I was thinking maybe we need to shoot for later in September or something to have our first public community meeting, and if we can't get all 5 board members there, again, that's okay too, because I think primarily it's an opportunity to hear from our community, and it would be greatly beneficial for me as your new superintendent to do that. So just kind of asking for a swap of time. I know your board meetings usually we have about an hour or so of public input, and so this would be your public input would kind of be shaved down a little bit at your board meetings, and you'd give up another hour on another night. So I know that's that's a lot to ask as well, but I think it could maybe go a long ways. I've heard from a few folks in the community that would really appreciate this opportunity, and I think it could go a long ways to help us answer questions and create that more communication strategy. So I think it's as quick as you would like to. I know that life is busy for everybody the next couple of weeks. It's the end of summer. You got a holiday coming up in a couple of weeks. So, perhaps maybe it's the middle of September to end of September that would work better for you. But if you wanted to find, if your date was in the next 2 weeks, we'll make it happen. We'll get the word out, and my biggest challenge will be to find a location. Yep. I think that's a great plan too. Great plan too. So I'll shoot for outside, and
I don't know how the other trustees feel. I'm all in for sooner rather than later. I just think it's a matter of, I think, obviously before 5 makes my schedule really difficult, but after 5 o'clock on an evening, I would make myself available to the best of my ability. And if we had maybe a couple dates put out there, I think Casey.
Yeah, I would just ask that if we could pick a couple dates and throw them out there to the board, have Lynn communicate those with us. Might be the most efficient way to figure out what works. I think evening after 5, especially if we're asking people to come join us. Maybe throughout the year that changes, and maybe we do a morning one time if it works with our schedules. For those people, some people morning's easier.
Okay.
And my preference personally would be not Mondays, which I know is funny because we meet on Mondays so much, but that is my day off from my paying job. And Monday's just a busy day in our family, so Mondays are a challenge, even though I meet 2 Mondays a month already.
All right, well, we'll definitely stay off Mondays, and I know those are busy days for many of you. And Monday Night Football is going to be coming on pretty soon, so we need to be ready for that. So, okay, well, we'll do this. We'll send out a proposal then of a couple of dates, and we'll try to get those on the calendar sooner than later, and let you all just reply back to us, and we'll try to find a date that works for the most of you, and we'll go with that for our first meeting, and then we'll kind of see how that goes. I'm confident that I'm confident that this can be a great communication avenue, and that people just want to. They just want to get some questions answered, so I think it'll be a great thing. Okay, other than that, then, I think we're all good here with. We're still working on that detail, so we'll give them that information a bit later. So the back to school breakfast, as you well know, that's still up in discussion as to what's the best plans. We certainly are sensitive to the fact if I bring 1,500 employees back to a gym and where we don't encourage masking or social distancing or anything, would we be putting our students at undue risk a week later when school starts? And of course our staff, would we potentially lose any of our staff that first couple of weeks? So we're trying to figure that out and come up with some avenues as well. I have the most person wants to make sure I have an opportunity to meet with all of our employees. So we're still working on those details, and we'll make a decision here very shortly because that date was coming up on the 29th. So I know Ed's super interested to know how much food he's got to prepare or not for our staff. So, okay, other than that, I think that's everything that I had. So thank you.
Okay, thank you, Dr. Hawker. And with that, meeting adjourned.